Hello, I'm Dr. Charles Martin. Today I'm going to ask you, actually I'm not going to ask you anything, I'm going to tell you about how you can choose an implant dentist. Implant dentistry is a field that has been developing for quite some time, and it's important to have and understand the right parameters so you can make a wise choice. So you can be a smart consumer who makes the right kind of decisions about having dental implants. I've been practicing implant dentistry since 1983, have dealt with some of those complex cases imaginable successfully. However, where you are, you need to have the right questions to ask so that you can make a wise choice. So let's start with how are you going to make a choice about choosing an implant dentist? Well, there's really 5 parts or steps to choosing the right implant dentist for you. First step is services. What type of services do you need? And what type of services does the implant dentist offer? You need an implant dentist who understands all of your care, understands what's going to happen both before and after implant surgery is done, and then the restoration of your dental implants. After all, dental implants are a solution that we didn't used to have. Consider them as like a third set of teeth. A dental implant is like an artificial tooth root in that it replaces the missing tooth root in your mouth, in the bone or on top of it, so you can build new replacement teeth. The great advantage is that you regain your ability to chew like you had your natural teeth. You preserve the bones in your face so you don't become prematurely older looking than you are and have teeth that work instead of something removal that flops in and flops out. So, do they provide all? That's the first one, is services. Does the doctor provide all the services you're going to need? Are they going to be able to do bone grafting, do the surgery, do the restoration? Are they going to be able to replace the missing tissues you may need? Often I end up seeing patients who have been told you can't have dental implants. Well, we know the vast majority of the time that's not true. So one is services. Number 2 in our acronym of steps is training. How much training and from whom? It is important that the dentist has a well-balanced, well-rounded, deep education about dental implants so that no matter what shows up, what happens, you can be assured that the right thing's going to be done for you. I've been doing implants since 1983 and have spent gosh knows how many hours and days doing training at private institutes and university-based programs to understand all the ins and outs of dental implants. Dental implants is at once probably the most complex thing we do in dentistry because it integrates so many different parts of getting dentistry done. Cosmetic dentistry, sedation dentistry, the restorative, the smile design, the whole mechanism of your chewing function. So it integrates all of that. So you have to make sure that the person has enough training so you can get the right kind of care. The third thing in our STEPS acronym is experience. How much experience? Are they new to the field? You know, experience is important from the standpoint of knowing what to do when a particular situation shows up. I tell my patients, no matter what happens, we'll get to handle it. So it's nice to have that level of understanding, that level of trust with your implant dentist, that they know what they're going to do in case something that you don't expect happens. And that's another thing. You can probably expect that something is unexpected is going to happen. Expect the unexpected. The fourth thing is passion. Do they enjoy being an implant dentist? Do they like the work itself? Do they get a kick out of providing the service? You know, implants are used to provide solutions, and that is all they're for. Even though I've been doing implants since 1983, I look at them as a solution. They're not always the right solution, but presently they're probably underused. In fact, dental implants probably should be used more than conventional bridge work. The last of our STEPS acronym is success. Ask to see the before and after pictures of patients. Ask to see if they've got video testimonials of the patients that shows actual casework done. See if they've been endorsed by other dentists. Let's look at the doctor's training, his curriculum vitae, all the things that he's done to make himself qualified, to be competent to serve you well. Ask for written testimonials and then ask him, what do you do to stand behind your work? In our practice, we assure patients, and then we make good on that the work we do is going to last. So the 5 steps are services, training, experience, passion, and success. You know, we see patients from all over the United States and even some of foreign countries. But where you are, if you can't manage to come and see us, Let us know. We'll help find a dentist that does implant dentistry the right way for you. So you can be a smart dental consumer. I'm Dr. Charles Martin. Thank you.